Hello, good morning, as you all, or good afternoon, depending on what time zone you are in. As you all are joining into this session, you should be joining into Nursing Home Quality Essentials. That's where we are. We're going to get started here in about a half a minute. Come on in and use the chat feature, please, and enter your name, the name of your organization, and what state you are in. What state is your organization in? And if you don't want to do the chat, feel free to unmute and say it verbally. We like that too. All right, I've got 12 o'clock Central Time. It must be 11 o'clock Mountain Time. Thank you for joining. My name is Mickey Raymond. I will be your facilitator for this 30-minute session, Nursing Home Quality Essentials. Today we're going to talk about QAA meeting essentials. And what is QAA? And why do some people get tags, F tags on it? How does it play into QAPI? We're going to focus in and really zoom in on QAA. Before we begin, though, if you haven't already, please add QIConnectTelligent.com to your email contacts. We want to be sure you get all the information that may be relevant to a topic that you like, that you can jump on a webinar if you want. We're on social media as well, Facebook and LinkedIn. Also, if you'd like to sign up for the listserv Nursing Home Connect, that's for nursing home leaders, staff, to be able to have interact with each other across Telligent's 4 states of Colorado, Illinois, Iowa, and Oklahoma. You can actually have conversations about maybe concerns or topics or something among yourselves. And it's a really great network to hook up with the Telligent nursing homes. Also, our nursing home dashboard, we do have assessments to help aid you on quality improvement, We have COVID preparedness assessment, making sure that you're still got your information out there. You're doing trainings on that. Nursing home emergency preparedness assessment. We know that EPP is an annual thing you need to assess and have documentation of and be prepared. The IPC, or infection prevention staff training attestation, to let everyone know, CMS and your peers, that your staff are trained on infection control. And it's really in servicing. Do you do skills fairs? Do you have electronic health records or electronic platforms that you train on? Unplanned transfers, we always also talk about that. Trainings on reducing emergency department visits, that may be something you could manage. And also readmissions. And finally, health equity in the class framework. So be sure and check out those. Today, we're talking about QAA meeting essentials. The objectives, we've got 2 of them. Explain how quality assessment and assurance, the QAA meetings, are critical in responding to quality deficiencies that are identified in your facility, and describe the quality improvement processes from the QAA committee to the QAPI steering committee. So it's like a flow chart. How do we get from QAA to QAPI? Are you too busy to improve? Have you ever been so busy that you can't take the time or stop or want to, or just don't have it to be able to stop and look at the improvement process? Well, if you don't take the time to do that, you're going to have barriers and you won't proceed. So be sure, it's always, always important to stop, look around, look and see what we need to do, get your team together to see how we can improve so you can reduce those barriers. Well, why do we need quality assessment and assurance? Well, first of all, as healthcare folks, as we are, we decided to go into healthcare. We're healthcare professionals caring for residents, maybe in our nursing homes or hospitals or skilled units. And if you are here from a hospital setting, awesome, you're there. You also chose to be a healthcare professional. We're into the leadership role, but it demonstrates our integrity as professionals in caring for our residents, right? It ensures that we fulfill our obligations for resident and patient, quality of life, quality of care, their health, and their safety, because we love our residents and patients. In nursing home settings, even in hospital settings, they're in a community, right? And when you're in a community together with lots of people, there's an increased chance of spreading germs or other kinds of adverse effects or things that happen. So having quality assessment and assurance supports healthy communal living. It also improves resident and staff satisfaction. We want to be there because we care, and our leadership cares about QA or QAA. Also, it improves quality measures and our 5-star ratings. So QAA requirements, it is a CMS regulation. It's a federal requirement. All right. The Quality Assessment Insurance Committee, it's responsible for identifying, and when they find a problem or a concern, then responding to that quality deficiency that they found or discovered, right? It reports to the governing body. If you're going to implement the Quality Assurance and Performance Program, if you're going to start the QAPI program, if you're going to start the program or implement it, you need to let the governing body know. That would be your board of directors, corporate leaders, maybe if you're part of a community hospital, if you're part of a county board of directors or a city board of directors, or just freestanding. Anytime you have identify a problem and you're going to have to bring in the QAPI team and implement the program, you need to let your governing body know about that. The committee reports activities, anything that's going on, including when they implement the QAPI program, to your governing body, right? It has to meet. They're required to meet at least quarterly. We're going to show you a documentation form so that you can prove that you actually are meeting documentation. It's comprised of the DON, the medical director or designee, 3 additional members. One of them needs to be an administrator or an owner, corporate leader, board member, or hold a leadership role, and also your infection preventionist. And that came on board phase 3 in November 2019. QAA also regularly reviews and analyzes data. All right, so you all know data is going to give you that information, whether there's an improvement or not. Did your audits go up from hand hygiene from 75% compliance all the way to 100%? That's what you want. Did it drop down to 50% compliance? What happened? So you need to be sure you've got those data sources from your iKeys reports or your audit forms from whatever tools, whatever data sources you use, and then analyze and interpret the data and take some action. QAA oversees the QAPI program activities, right? So they're the ones who identify quality issues. They're going to be the ones who document the issues. They're going to coordinate the QAPI activities. That would be your PIPs, your performance improvement projects, right? Develop and implementing plans of action because we want to fix, we want to correct those quality deficiencies that are identified. So here is a documentation resource for you, QAA. It's actually a QAA, QAPI meeting agenda. It is a fillable template that you can use online. You can print it off and handwrite on it if you want. You can adjust it to make it fit to your community and tailor it to your community. This allows you the documentation that you're actually meeting quarterly. And so it's regular data review and analysis. So data collected under the QAPI program, once they get determined, the PIP teams, someone will be in charge of collecting that data. Also collect that data resulting from your drug regimen reviews, looking for any adverse drug events. How many medications, how many antipsychotic meds are your residents taking? If you need to, any other antibiotic resources that you need. Act on that available data to make your improvements. Document all meetings. all those steps toward improvement. What are you doing? What actions are you taking? What are the outcomes? Document that. If you don't like the outcome, try a different intervention. And then you are not required, or facilities are not required, to share your committee records with surveyors, with state surveyors or federal surveyors, unless it's related to a committee compliance or non-compliance. What that means is regulation F, that's a F tag at 865, and there are several QAA F tags out there. People sometimes get it confused. What is QAA? How does that tie into QAPI? Who's responsible? So this is why we broke it down for this little mini session for you. But it's an F tag of 865. It does talk about good faith attempts to correct. So if you're taking pains to correct the action, then you're in good faith and you're ongoing. The interpretive guidance states if a facility did not take action when they should have, when there's evidence that they should have, state surveyors will be looking at that. Was there a resident injury? Was there a problem with a resident? Was the issue something the facility should have taken action on? Was it high risk? The problem, was it problem prone? Is it an ongoing problem going on in the facility? It happens recurrently, or it happens a lot, and there's no action taken on it. Maybe there was sufficient time to address the issue, but it wasn't taken. They didn't address the issue. So that, again, if your efforts are showing that you're making honest efforts to correct the problem, then the surveyors won't be citing you. They won't give you an F tag for QAA. However, they can give you an F tag if it's related to another problem, such as an F880 tag or infection prevention, or an F883, the vaccination. So they can decide and determine that they can give that F tag. But as far as good faith efforts and your documentation efforts for QAA, they will not cite you for that. Now let's talk about QAA. We're going to lead into QAPI in the next few slides here. QAA is the foundation for QAPI. QAPI is like the house that you're building in a way. QAA is the starting point, but you already had these systems in place. QAA came around about quality assessment insurance about 1999, when Health and Human Services and CMS determined that in healthcare settings, we need to articulate it and determine it and get it down, and made it a federal regulation for the safety and healthcare for our Medicare beneficiaries in healthcare settings, whether it's hospital or nursing home. So here's the QAA. These are things you're already doing before you move into the QAPA. You already have systems to provide care and achieve compliance with nursing home regulations, right? Because that's why you're there. You want to achieve. Nobody goes to work saying, I don't want to achieve this. I don't want to be in compliance with nursing home regulations. That may sound silly, but actually that's what everyone is here and striving for improvement. Tracking, investigating, trying to prevent those adverse events or recurrence of those adverse events, right? So you can also compare the quality of your home to that of your sister homes or homes in your own state or your corporation or across the nation. You can look at Care Compare and see what Alaska is doing or Hawaii. Setting targets for quality, going, we want to improve our hand hygiene compliance to 100%. That's setting a target. Striving for deficiency-free surveys. No one wants a survey. No one wants a deficiency. Striving to achieve the improvement in those specific goals related to quality measures. So ulcers, pressure ulcers, or pressure wounds, or falls with major injury, infections, UTIs. And then also balancing a safe environment and resident choice. Now that can be tricky when you're thinking about an outbreak, wearing masks, and now we've got the barrier precautions to also where you're wearing gowns in certain situations to reduce multi-drug resistant organisms. So trying to keep that balance between a safe environment, which we're obligated to do, and resident choice. So what's the priority here at that particular? You have to determine that. And assessing those resident strengths and any of their weaknesses so that you can create and develop a very comprehensive, person-centered, measurable, and interdisciplinary care plan for that resident. Right, so these are things you're doing under QAA anyway. And then QAPI, Quality Assurance Performance Improvement. Y'all have heard that before. I'm pretty confident that you have, unless you're brand new. QAPI was brought about in 2010 on the Affordable Health Care Act. And the Congress determined that. And what they're doing is they're extending it and making more accountability for having performance improvement where there's documentation. So what is QAPI? It's a data-driven, it's proactive, right? So we're trying to prevent things or anticipating a previous issue that might pop up again. And so now we're continuing and taking proactive interventions as part of our policy here at this nursing home, perhaps. I want to improve the quality of life and care and services in nursing homes. So activities would be involving all members at all levels of the organization, right? Not just the DON and IP nurse and nursing home administrator and the physician. You're also including maintenance, you're including environmental services, dietary, anyone who is social services, anyone who has invested interest in a particular issue, want to know what's going on. Also your pharmacy consultant, very integral person who needs to be there as well. So then they're also identifying opportunities for improvement. They're meeting and talking with the QAA committee as they bring that information to the QAPI steering committee. So they help uncover those gaps or weaknesses in your systems and processes, addresses those adverse events, develops and implements improvement plans, right? We're actually doing it. And then you're going to gather the outcome data to see if it worked. And you're continuously monitoring the effectiveness of the interventions. So here we have it broken down: QA, quality assurance plus performance improvement. QA is that process of ensuring that quality standards are met at this acceptable levels. Okay, so there's a baseline level that you need to meet. It's reactive. That means if there's a problem, then that's when they take action. They're reacting to a problem to try to solve it. Once that standard is met, usually that's ended. They close the book on that. In a word, that's what that means. So performance improvement, PI, continuous study of processes with the goal and the intent to improve those processes and elevate the quality of care. You want to be above. You want it to be above the quality of care standards. Be the best you can be. Quality assurance and performance improvement, QAPI. So we know that is data-driven. We won't know if we're improving or not improving, or if we're sustaining an improvement if we don't look at our data. It's proactive, a proactive approach, meaning that's something that's continuous. They're looking at, always at systems to help be sure that those try to mitigate any kind of a problem or infection or anything else that they've dealt with before, because for the goal of improving quality of life and care and services. Let's look at these side by side here, the QAA committee, QAPI steering committee. Requirements, QAA committee has that requirement, federal requirement. You see the number there. When you see that symbol before it, it looks, I don't know, I forgot the name of that symbol. That means it's a federal law. So it is a law that you have to do this. You have to have the QAA committee. And there are consequences if you don't. And that would be related to survey citations. QAPI steering committee, it's not required, but highly recommended. Most people do it. Most teams do it as you meet as a group, because it takes a lot of people to have their voices heard. They may offer something based on their observation. Attendees required for a QAA committee is the DON, Director of Nursing, Medical Director, Nursing Home Administrator, administrators at hospitals, 2 other leadership folks, anyone in that position, and your infection preventionist is required. And your QAPI steering committee can be any person, staff member, including the nurse aides, medication aides, your activities department, environmental services, dietary, anyone there who can be a part of it. Meeting frequency requirements, QAA committee has to meet at least quarterly. QAPI steering meeting doesn't have requirements, but they're going to meet as often as they can based on availability of staff and other things going on so that to achieve the goals. That's how often they're going to meet. Goals would be of the QAA committee to review and evaluate all the facility data sources to determine those areas of focus for the QAPI steering committee. And facility data sources could be your IKEYs, your MDS, CASPER reports. We're also looking at accident reports, admission forms or discharge forms, ED visits, any other source of data, anything on a dashboard from your corporate if you have one. QAPI steering committee just reviews the data, including the resident level data, right? So we're running that CASPER or IKEYs report, the resident level to see who are triggering for the measure that's in question to determine how best to utilize the elements, QAPI, and that would be root cause analysis, QI methods, anything else toward improvement. QAA drives the QAPI process. So here we are breaking it down even more. QAA committee meets at least quarterly and as needed, analyzes data, charters a PIP. There's a problem, performance improvement project. A PIP creates a charter. Who's going to be on the team? What's the goal? What's the problem? Who's the team lead? That's your charter. It's going to be tracking all your activities as an ongoing document. The PIP team leader creates the agenda, schedules meetings, investigates the problem or an adverse event, whatever needs to be addressed. And then RCA and PDSA cycles. So complete a root cause analysis in RCA, run a plan, do, study, act cycle. And I'll just stop there. Telligent does offer learning management online trainings for root cause analysis and plan, do, study, act cycles. So be sure and check out all of the activities if you want to strengthen any of your processes there. And then always make plans to sustain your improvement. You don't want your improvement to stop. Once you meet that goal, don't stop. Keep it going. If you stop, it may drop again and you may have another concern. So how are you going to keep it going? You've got something good going on. Let's keep it going. Here's QAA committee in action. This is an example from COVID-19. On the left, the COVID-19 data submitted to CMS via NHSN every Wednesday at 1. So that's what they're doing. That's what they determined. The QAA committee decides to meet weekly, since your data is due weekly in NHSN, on Wednesday mornings from 9 to 10. So they meet before the data is submitted, tracking it. QAA meetings, they review and analyze their electronic health record, CASPER data, review MDS reports, anything along that needs to be addressed, falls reports, review and analyze COVID-19 data prior to entering in NHSN related to infections, and then review the data from PPE audits. So they conducted some audits for PPE. What they show, the data reveals, it shows 50% compliance with donning and doffing. And we know that is not good. We know it's not okay. You should have PPE with compliance of 100% with donning and doffing to mitigate the spread of infection. Same thing with hand hygiene, needs to be 100%. So that is a problem. The QAA committee is going to act on it and send it right on over. They can unanimously agree to charter a PIP for PPE, and they tell the QAPI committee. Now they're going to look at why. So they're using the 5 whys to determine a root cause analysis, right? Here, they're not using 5. Here, they were able to determine in three whys, and that is okay. So why are staff non-compliant with PPE donning 50% of the time? Why? Why are they? Because staff have too many residents assigned, so they're rushing. That was identified. Staff do not think you can become infected from a few minutes of exposure. That was identified. And also, staff believe it takes too long to put on PPE when they'll only be in the room for a few minutes. So now as we move on, they pulled out that they want to work on. Staff believes it takes too long to put on PPE when they'll be in the room only a few minutes. And the guidebook over here on the right that you see on the slide here is up, and you can access it on Telligent. It actually goes through the QI processes for root cause analysis, Plan, Do, Study, Act. It has some interventions you can explore and a lot of great resources. So now the team is going to brainstorm those ideas to eliminate the root cause. So they start with educating staff on facts about PPE, how it could be a barrier. They have practice sessions to learn how to don and doff quickly and safely. And they complete a time study to determine how long it takes to don and doff a PPE. So this is just a snippet from an example of what a team determined they were going to work on. Here's the PIP team in action, right? So who's on the PIP team? You need a person from facility leadership. Could be an ADON, could be a DON, it could be the administrator. It could be a corporate person or the corporate clinical nurse in a region. Could be whoever you determine. You need at least 2 frontline staff from the unit. They're going to have that have the highest non-compliance with PPE donning and doffing. And what that means is you're not highlighting them or featuring them, telling everybody they were the highest non-compliant staff. You're not going to do that because you want to encourage them, and it's a learning opportunity. And so they pull in those 2 identified staff who were non-compliant with donning and doffing to be on the team to work on improvement and also gain some skills, and have at least 1 staff person from all departments that use PPE. This is an example of PIP team meetings here in this illustration. I'm just going to rocket through this one here due to time. You don't have to have 5 meetings. Again, it's an example. But examples would be reviewing the charter, discuss the PPE audit, maybe on your meeting, you're sharing knowledge about the problem and complete a root cause analysis at the first meeting, perhaps. But you need to take some action pretty quickly here. So you don't want to go 1 meeting a week for 5 weeks. We need to start activating quickly. So you may combine some of these things if you're able to work through it. Do a plan, do, study, act, see if intervention's improving, and then analyze and discuss the results, adjust it as necessary. If you don't like the results, go back and try something different. If you like the results, keep it and make it a policy, make it part of your procedure. Now, leaving it in action for you guys. Identify those team members who will participate in QAA meetings. Create a plan to move strategies and interventions from concept to practice. So here you have some strategies, you've got some interventions, you're thinking about it, so now let's do it. Move it into practice. Update those appropriate policies and procedures if you need to, be sure and train staff at annual trainings, competency trainings, audit, compliance, new staff onboarding, skills fairs, however you do it. You can also call Telligent, we can also help you with that. And then involve and inform staff, residents, and families of improvement activities. Let them know that you're working toward improvement because you care about them. I'm going to pause just for a brief few 7 seconds, see if anyone has any questions in the chat, or unmute.
There's nothing in chat at the moment.
Thank you, Heather. And I failed to introduce Heather. Heather is our chat monitor today. I want to be sure and acknowledge her because she usually does the chat and sends out the emails. Contact us. Here I am here if you want to have any questions. Also, Nursing Home Quality Essentials. Don't miss out for next week, Tuesday and Thursday. Both will be QRP SNF or skilled nursing, staff flu vaccination reportings, NHSN office hours with Kristen. And then a week from Tuesday, April 30th, it will be Health Equity's role in trauma-informed care, part 2. I thank you so much for joining today. Have a wonderful rest of your day. Reach out anytime if you have questions or if you feel that you want more explanation. Thank you again for joining.